The illiosoas is made up of two parts. There is the psoas major portion that comes from the spine, runs inferiorly to cross the hip joint, and attaches into the lesser trochanter of the femur here. And the iliacus portion, which attaches to the internal surface of the ilium and crosses the hip joint to join the psoas major on the lesser trochanter. To palpate the belly of the psoas major, we find the ASIS and belly button and then go halfway in between. Or we can palpate for the lateral border of the rectus abdominis, which is right here. Once we find the lateral border, drop off it just a bit laterally, and then we can use this location to palpate the belly of the psoas major. We ask the client to slightly flex the trunk forward, which relaxes the anterior abdominal wall, and we ask the client to take in a breath, and as she lets the breath out, we sink in posteromedially toward the spine. We ask her to take another breath in, and as she lets it out again, we sink in further. We are now against the belly of the psoas major here. To engage the psoas major, we ask the client to lift her foot off the floor, flexing the thigh at the hip joint, and we can then feel the contraction of the psoas major. It is important with this palpation to be firm, but to be gentle and sink in slowly. We palpate as much of the psoas major as we can in this manner.